Hi, my name is Rachel, and today I'm going to be talking about the week 6 assignment. So the first thing I wanted to discuss are the labs that we were given. I wanted to look at whatever labs were abnormal. So the first one is sodium. I'm actually going to talk about sodium and chloride together since they're both low. So studies have shown that patients with rheumatoid arthritis actually excrete these electrolytes much faster than the average person. If their symptoms are not managed, then it is likely that they will have lower levels. As we can see in these labs, both are low. So, and it is possibly due to the fact that the disease is not being managed. Another lab level that is key to rheumatoid arthritis is the inadequate amount of cortisol secretion. So usually a patient can take medication to help to manage their this hormone and help to replace it. However, this patient is not able to take these medications, so her cortisol level is low. This results in the patient having this adrenal insufficiency since it's not able to secrete the hormone. So what are some other ways that we can tell that this patient is suffering from adrenal insufficiency? Well, for starters, this patient is exhausted and is finding it difficult to accomplish activities of daily living, such as getting dressed or moving around or eating. So the adrenal gland is responsible for a variety of functions throughout the body, such as putting sugar into the blood or adjusting the body when as carbs and fats are broken down, and it helps control the blood pressure and the heart. So since this patient's adrenal gland is not working properly, the body is struggling to complete these tasks. Adrenal androgens are not being produced, very little sugar is getting into the blood, and the body is most likely struggling to break down the proper nutrients from food. Thus, the patient does not have an appetite, feels weak, and just does not feel well in general. The patient is also dehydrated. When a patient experiences adrenal insufficiency, they may also experience excessive fluid loss, which can lead to dehydration. So why is this patient experiencing these symptoms? I thought this was interesting when I was researching it. So when a patient is taking steroids, their adrenal gland can become suppressed. This is due to the constant steroid exposure. Eventually, the hypothalamus stops signaling the adrenal gland to keep making cortisol, and the adrenal gland atrophied. When the patient stopped taking the steroids, the adrenal gland was still atrophied, so the cortisol production is much lower than what it should be. It is likely that this patient was taking a steroid such as prednisone, a medication that is very similar to cortisol. The body did not see a need to keep making the hormone, so now this patient is experiencing prednisone withdrawal, possibly. Normally you would taper off the dosage so that the adrenal gland can gradually resume production and get used to creating and excreting cortisol. Due to the fact that this patient suddenly stopped a steroid, it is likely that they are experiencing secondary adrenal insufficiency. This means that there was simply a drop in the adrenal gland production of cortisol. However, the adrenal gland is not permanently damaged, and cortisol production can resume over time. Aldosterone is also still being produced in secondary adrenal insufficiency. In contrast, primary adrenal insufficiency, aldosterone would not be able to be produced. The best way to check to confirm that it is secondary, a secondary cause, is through an ACTH stimulation test. This is when cortisone is injected into the patient. Their ACTH and cortisol levels are tested before administration and then an hour after the administration. If there is an absent response or a very small response, then the physicians know that the adrenal reserve is abnormal. So how can we treat it? So treatment typically involves replacement therapy. The patient will have to take medications that replace the hormones that the adrenal gland is not producing. For example, this patient may need to take hydrocortisone tablets orally once or twice per day. Prednisone may also be given since it is longer lasting. Extra doses may be required during periods of stress. This might include when the patient is experiencing a fever, infection, a large injury, or surgery. If the patient is unable to take these medications orally, then they may be given hydrocortisone, which is the normal medication that would be given through an IV. It is important to remember that patients who are tapering off these medications over time may have similar symptoms than what they are now, since that is the only way to stimulate the adrenal gland again. When a nurse is caring for these patients, they should encourage oral fluid intake, assist with activities if needed, minimize stress, encourage rest, monitor intake and output, and monitor their nutritional status. The absolute first thing that a nurse should educate the patient on is the importance of not stopping the medication suddenly. We don't want this to happen again. Educating them on the physiology and what can happen if this occurs again is a good way to do this, since it allows the patient to understand why they shouldn't just stop that medication. They understand the why, and that gives them a good incentive to not do it again. It seems like the main problem with this patient is that she simply cannot afford her medication. One thing that a nurse can do to help, and that will make a huge difference, is to provide resources so that they are able to afford their medication. There are many organizations and partnerships that exist to help patients pay for their prescription medications. They are usually sponsored by drug companies or physicians so that patients can get the medications that they need. Be sure to provide the patient with the names of various organizations so that they have somewhere to start. I would also make sure that the patient has like a case manager as well, so that they have some extra help. This way everything will not feel as overwhelming and stressful, because this patient is also probably dealing with a lot of stress with her husband losing her job and now her symptoms, so it's hard to complete normal activities. So she'll be much more likely to comply if she has someone that's able to help her and guide her through this difficult process. In conclusion, adrenal insufficiency is actually becoming a more common issue that can result from the sudden cessation of steroids. Thankfully, there are ways that secondary adrenal insufficiency can be addressed and the adrenal gland can resume cortisol production. I hope you found this video informative. Thanks for watching.